Hey, how you doing? Dr. Glynn, clinical psychologist. Today, I want to talk about something that a lot of patients that I see share with me as a concern. So I wanted to just give you my thoughts on the idea of whether or not to tell people you're having bariatric surgery. So a lot of patients come in, they're concerned, should I tell friends, should I tell family, who should I tell, how should I go about doing it? So the first thing I always share with everybody is that the biggest thing about deciding whether or not to tell people is, first of all, getting comfortable with your own viewpoint of having surgery. Okay, people are often concerned that other people are going to judge their decision. They're going to give them feedback about their decision that they're not necessarily asking for. So the first thing, as I say, is to get your own comfort level with your decision to have surgery. If you have got to the point where you're going to have weight loss surgery, okay, oftentimes it's not a sort of a click of the fingers kind of decision, a snap decision that you come up with. It's a decision that you've taken your time about, you've researched it, you've looked into the various options, and you've really given it a lot of thought. So by the time you get to that point, you've obviously realized that this is the best and right decision for you, okay? So once you get to that and you're comfortable with that decision, okay, if you decide to share it with people or not, again, is totally up to you. What I often say to people is, listen, at some point people are going to notice, okay? Especially when you have bariatric surgery, your weight loss often is very extreme, okay? In the sense of you lose weight very quickly, which oftentimes when people are sort of regular dieting, they don't lose weight at the same rate. So you'll lose weight very quickly, and people are going to start to notice. Now, if they start to notice, they're going to start to have their own opinions and ideas and thoughts about what's going on. My always kind of approach is I'd rather be in charge of when that information gets shared rather than having to react to people's questions. So that's the first thing. So people are going to notice. So if you're going to put off telling people, you don't want to tell people, then sort of be prepared that they may come to their own conclusion. They may ask you questions. And if you're not prepared for that, then sometimes that can throw you off. The second thing is, as I say, once you've taken the time to research it and really come to terms with the decision you're going to have and figured out that it's the right decision for you, then trust yourself, okay? You've decided this is the right decision for you. So then when you present the information to people, if you do decide to tell people, you have to tell people from a position of, this is the decision that I've made for myself. This is the decision that I feel the most comfortable with. This is the decision that I think is in my best interest. So your approach is to share the information as kind of like, I've decided this, I'm having this done, and this is happening. If you share the information with kind of an idea of like you're kind of not sure and the way you're presenting it is kind of like open-ended and it's inviting feedback, then you're going to get feedback, you're going to get thoughts, you're going to get opinions. But if you present it as a very matter-of-fact way, the majority of people will accept that and they'll accept your decision. Obviously, it's not a foolproof plan, and there are people who will give you their unsolicited advice and thoughts no matter what you say and how you present it. But for the majority of people, they'll kind of take your lead on it and recognize that you have made the decision, you're not looking for feedback, and they'll respect that. So if you do decide to tell people, that's my advice to people is own the decision. Be comfortable in yourself about your decision. You're not taking the easy way out. Having surgery is, definitely not an easy way to go about this. Often people throw out like, well, why don't you just try dieting? Why don't you just try this and that? And, if that worked, you would have had success with that by now, because obviously by the time you get to the point of choosing weight loss surgery, you've had many different attempts. So if you're comfortable with yourself and you're comfortable with your decision, then that will kind of feed out there to people and they'll kind of respect that and notice that and react accordingly. Again, not a foolproof plan, but it will happen. So that's the advice I often give to people. So firstly, really own the decision. Okay, you've made the decision, it's the right thing for you, you know it's the right thing for you, own the decision, okay? Recognize that people are gonna notice, so if you don't share it with them, and it's totally okay not to, at some point you might field some questions that you're not prepared for, so you have to be kind of prepared for that part of it. But ultimately, it's about you, it's about yourself and what you have decided is in the best interest in you. And by the time you made that decision, it's the right decision, okay, for yourself. So that's how you present it. So hopefully this has been a little bit helpful. Oftentimes when I share that with people, they kind of get it and understand, and they think, you know, it's a decent way to go about it. Again, if you like the videos, please subscribe. There should be a subscribe button kind of right up there. Please hit that, and that way you'll be updated with more videos as and when they come out. But hopefully you found this one a little bit helpful, and if it's a sort of question you have going around in your mind, it gives you some sort of a frame to be able to figure out what to do next. All right. Again, if you're having surgery, good luck, and hopefully check you out in the next video. All right. Thanks a lot.